All right, now we go live on Facebook. Just takes a minute. I make sure I choose the right place. All right, we are live. Welcome, everybody. It is Thursday night, and we are here with Dr. Carla and Dr. Loria. Thank you so much for joining us tonight.
Thank you for having us.
Thank you. We appreciate it.
Thank you. So the topic tonight is healthy habits to help kids thrive. And Angela is going to do the honors and introduce our speakers.
All right. Thank you, Renata. Welcome, welcome. Dr. Carla Damon and Dr. Loria, Nahatis, both mothers of 2 children, are on the forefront of pediatric dentistry. They apply their expertise and experience with their own children in pediatric anatomy, physiology, craniofacial growth and development, and how a child's behavior and habits affect dental health to help them thrive starting from infancy. As board certified pediatric dentists, Dr. Carla, along with Dr. Loria, operate Beyond Pediatric Dentistry, a private practice in Dallas, Texas. Their practice is limited to pediatric patients with special emphasis on airway screening and treatment, performing infant frenectomies, and providing a more wellness-based approach to dental care. Welcome to Airway Circle. We are thrilled to have you.
Thank you.
So we are just going to let you guys start with your topic. Why did you pick healthy habits to help kids thrive? And you can just give us a brief intro.
Yeah. So we're a newer practice. So we see a lot of young kids, 0 to 18, but most of our patient population is actually really young. So 0, 1, 2, 3, 4. And I think probably some of the number one questions we get are about pacifiers and sippy cups and foods and baby-led weaning. And so I think it'd be fun just to chat about those kinds of things and what we tell our patients and the recommendations we give.
Yeah. No, I think too. So I had a mom recently, just last week, she brought her, I think it was like 2.5, 3-year-old, and, still using a pacifier, still doing like some of the things that we know we probably shouldn't be doing now. I mean, I didn't know it 10 years ago. It's just knowing more and more about, better things that we can help our kids grow in a more optimal way. And she was pregnant, and I don't think I even told you this. And she was like, so it sounds like maybe I should bring this one in before 12 months. Like, what age do you like seeing kids? And I said, gosh, I really love seeing them right before like the AAP and AAPD. They both recommend, 12 months or 6 months after the first tooth erupts. But what Dr. Carla and I love is seeing like the 6, 7, 8-month-olds who are starting to get their teeth in.
Mm-hmm.
And we can talk about what type of cup we're drinking from, what we should be eating, should we have purees and pouches and, the pacifier, all of that. And I feel like just starting with simple things like that and just parent education, it can just change the trajectory of their growth throughout life. So
Exactly.
yeah. So I didn't tell you that, but I was like, yes, bring them early, 10 months. That would be awesome. 8 months, whenever.
Yeah, go ahead.
We do a lot of infant frenectomies. And so we really try, it's not just about the procedure and the post-op care and getting the child ready. We really give the parents a ton of information every single time we see them. So we see them for 3 post-op visits, which people might think is a little bit excessive, but if you can plant little seeds in those parents' heads every time you see them, you're giving them so much information and so much power to then go home and, put these things into motion. So it's a lot of fun.
That was going to be my question, is how early do you see them in the dental office? It's a question that we get often of these little babies or kids, 11 months old or 9 months old, mom already knows my child is breathing through your mouth. Where do I go? What do I do? That age right there until about 3 or 4, they're kind of lost because they're all told that you can't do myofunctional therapy this early, but they don't really know what to do. So what would you tell this parent that has a child younger than 3 that is complaining of mouth breathing?
You want to go ahead?
Yeah, I can start talking. So,
I mean, that was not written down.
I'm like, stop. I don't want to start talking over. So, the thing I talk to moms about, because that is a hard age, because we know, like, if they're mouth breathing and if they have certain habits, they could indeed be tongue tied. You know, they could have and you know, when we say tongue tied, I know all of us here know we're looking at function, you know, elevation of the tongue. How are we using the tongue? And, you know, sometimes we have a 2.5-year-old where we do see a tongue tie. We also see the lip is very restricted too, and it can affect speech and feeding, things like that. We can help with that. We have great feeding therapists here in Dallas that we refer to help with things like that. Like, I feel like Carla and I are more like quarterbacks in those cases, because we can't physically do anything, you know. I mean, we have little appliances like we like the munchie, the baby munchie, and, you know, we can recommend things like that to get started. And we just talk about healthier, you know, habits and things that we can do to help improve things. It's just, it gets a little tricky from that 18 months to like 3.5, 4, where they can sit in the chair and actually have a procedure done or work on oral myofunctional therapy. So do you have anything to add to that about that age?
Yeah. And I mean, I think it's trying to get to root cause too. So we try to ask a lot of questions like, okay, well, what are they eating? Are they eating a lot of dairy? Are they eating a lot of things that are inflammatory that could be causing some of those mouth breathing signs and symptoms we see? Or is it habitual? Is it structural? Like what's going on to cause the root cause? So it's sometimes a lot of just chatting with the parent, figuring it out, and then, you know, they come to you, and what we think is so obvious is not obvious to the parent. And so it's like, okay, I want you to go see the ENT.
Yes.
I want you to do this, and I want you to do this. And when they have that little list of 3 things to do, or, you know, however many things we give them to do, it just seems easier for them. And then they have a plan in place, and they've never had a plan before. They're just stressed because their 2-year-old snoring.
And they know something's wrong, and they mention it to other healthcare providers, and the other healthcare providers are like, it's okay. They'll grow out of it, or it's normal to snore, and it's normal. Like, I hear like gasping for air. I'm like, that's not normal. So yeah, I mean, that was something too. I mean, the kids come in their mouth, like completely mouth, and you can tell they probably have huge adenoids, you know, tonsils. It's hard for us to see that. And so that's an immediate referral to an ENT. So,
you know, I am so proud of this field. I am so proud to say that I am a hygienist and I've been in the dental field, because what you guys are doing, being busy, how busy dentists are, but going outside of your way to learn all these extra things and to do better for your patients. I had a patient today that saw 4 different ENTs, and all 4 of them said, it's fine. I mean, let's just take adenoids out. The mom was like, but why? Are you going to scope? No, we can just go ahead. I mean, if you're worried about it, I guess we can do it. And I mean, this child is so nasal. I mean, he talks like this. Obviously, you can tell it has all the adenoid, you know, signs, adenoid issue signs, the bags under the eyes, nasal, speech. But the mom is like, I want some concrete, you know, evidence. I want somebody that comes in and says, listen, this is what we're looking at, and this is what we think your child needs. But he said, I've seen kids worse that are more nasal. He's not that nasal. And I'm like, you know, so I am so proud of dentists for going, you know, outside. I mean, you guys are so crazy busy. You have families, your moms, but you find time to take extra courses and just to keep learning. When we all know, we are all aware that if you decide to just do dentistry, just do regular dentistry, you'll be busy enough that you don't have to, you know, do anything else. So kudos to you guys. I'm super proud. Angela, do you want to read Dr. Hernandez?
Yeah, sure. Thank you. Another thing that I heard today, actually, before I read that, is you'll grow out of it. That
a lot.
You grow out of it until you see another provider that actually sees what's going on.
Right.
All right, so this is kind of a scenario, and it looks like Dr. Hernandez would really like your suggestion. I'll go ahead and read it. How do you negotiate an airway conversation with a parent whose child has fixed orthodontic appliances from another orthodontist, oral, breathing, and skeletally, one can tell that both maxilla and mandible are underdeveloped, flat upper lip in parentheses. One parent reports the kid's sleep great and solid. The other is worried that the orthodontist has closed spaces and she is worried about inadequate space for tongue. Refer to sleep specialist to rule out sleep issue. What are your suggestions? Thank you for sharing your knowledge.
Well,
Yeah, I think first I would do an exam on them and get their symptoms, signs and symptoms. And we give every child the pediatric sleep questionnaire. And then I would go from there. So are they snoring or heavy, what are you seeing or what's the parent seeing that has them so worried? And then go from there. And then if there's signs and symptoms that need to, go to the ENT, then I would suggest ENT or the sleep physician or even myofunctional therapy, because the myofunctional therapy is going to really hold them over if they're in expansion and make sure that they retain those dental arches that they, that they just had expanded.
I want to show you guys a photo. I'm not sure if I'm going to be able to. Maybe I can put a sticky note on top of his eyes. But she's talking about the upper lip. Let me see if I can show this photo to you guys. This is a patient that I've seen probably 10 visits. There he goes. Can you see? This is before. Look at his upper lip. Oh gosh. Can you guys see it? I mean, they've given me permission, but there he goes. So photo on, with the white t-shirt is after 10 sessions. Look at his upper lip.
wow, good job.
But he just went to a different orthodontist and now put elastics. I know, traditional ortho, because the other one was taking too long and they decided to go traditional ortho. And as soon as they said they put elastics to bring the upper teeth back, and I'm like, really?
Perfect.
Look at the progress I've made. But anyways, let's see. Why is it so important to treat the whole child?
Well, so 5 years ago, and Loria and I were the same. We were treating, dental decay, dental disease
here.
And we still, obviously we still do treat dental disease, but usually there's a root cause to dental disease, and it could be mouth breathing or reflux or, things like that. So we like to take a step back. We take a long time with our new patient exams. It's not run them in and run them out, try to clean their teeth and take x-rays and, send them on their way. We really try to get to root cause and ask questions. So we have a health and wellness questionnaire we give every patient and a pediatric sleep questionnaire. We really dive into interviewing the parent, and we talk about birth history and breastfeeding difficulty, feeding difficulty, all those things that could lead us to where the child is today. And then we try to look at the whole child, because if they are mouth breathing today, they're probably going to have sleep apnea when they're older. So it's really important to us to treat the whole child versus that, 2-inch box and just treating the teeth.
Just fixing cavities and sending them off along their way. Yeah.
Are parents ever overwhelmed with some of the information? Because
So we learned this the hard way. So when Carla and I first were in our practice here, which is a fairly new practice, we've had this for 2 years, that, where it's based more on whole child wellness and root cause and airway. But, I was so excited. So parents would call just because we also see, comprehensive, normal, what I call, parents that call, and I want a dentist for my child. And I want a cleaning, and I heard y'all use clean products. So that's why I'm going to come, like cleaner products. That's what I'm going to bring to you. So they bring them in, and, at first I, would go through the PSQ, like go through everything. And, these moms, and we had one dad, I'll never forget. He's like, why are you asking me these medical questions? And he was like mad at me.
yeah.
And in my head, and I just got really, I'm in my, in my heart, I'm like, I have your child's best interest in mind. And I caught, it really hurt my feelings. And I remember I had to step back for a second and just think like, okay, he doesn't know, it's okay. He probably has other things, when you think people, when they act ugly like this, they probably have something else going on, and not to take it personally, which, we all want to do first.
So hard.
Studied so much. And it's like, I know so much that I can help you, and I'm learning, you know what I mean? It's just, I'm here to help. So I came back, and I apologized. I said, it's just part of our 2017 ADA, it stated that we check for these sleep related breathing disorders. And, this is a validated sleep questionnaire. And I'm just, want to help if there's anything I can help with. And I gave him very kindly that little ADA pediatric sleep brochure. And then of course he like calmed, and I said, and I am a doctor of the mouth, because he said, you're asking these doctor questions.
Yay.
I said, and I am the doctor of the mouth, and we can see things in the mouth that can tell us that there may be other things going on. So I did not mean to offend you or your child. And that was it. Right. So we learned so from there, and we had other things too, Carla, right? Where we saw decay, and then we want to do expansion, and we're giving these like big treatment plans, and the parents are like, oh my gosh, like this is like too much. So we focus first on dental disease to take care of, any caries, and we plant seeds like, oh, I noticed your child is biting this way in a crossbite. Have you noticed that before? And kind of let them own it. Like, oh yeah, I have noticed that. Right. So they have to own the diagnosis, which is something that we've learned from one of our mentors. And then we just, well, let's take care of this first. And then after we're finished with this, let's dig a little deeper and see, why is this like, is there no tongue spate? Like, is it because we have a tongue tie? And just kind of just plant little seeds, not go too far into it. And what we've been doing lately, we'll finish with any treatment that needs to be done. And then we'll take a CBCT if it's warranted. Like if they have a high PSQ score and their sleep isn't, well, and mom is reporting symptoms, we send it off to a radiologist, take photos, and then we can bring mom back and then discuss the structure and development and growth and development of her child. So we've learned the hard way. You cannot, with a new patient, just throw it all out there, because it's way too much. But then we also have parents that come in for that reason, the Airway, and then they're the ones that we can ask all these extra questions because they want to share all of that with us.
Exactly.
So I know that's a long answer to your question, but
it was perfect. I do have a question about collaboration. So in the Dallas-Fort Worth area, how did the whole collaboration come about? And I have a couple of run-on questions as well. And how are you able to coordinate care among professionals? And how can other practices create a similar professional collaboration in their community?
Yeah, so I started, and you might have to remind me of this. I started the DFW Airway Collaborative, gosh, it was probably, I want to say 2019. And we were meeting probably 3 or 4 times a year, and then COVID happened. And so we did a couple Zoom visits, and we're actually having our first big in-person event next month.
Yay!
I know. Yeah. Dr. Zogby's coming in town. Loria is going to become an affiliate. And so he's coming, and we're going to combine it with the collaborative and invite everybody. But, I was really nervous because I was putting myself out there that, this is my passion. This is what I'm doing. I want to bring together not just dentists and hygienists and myofunctional therapists, but also chiropractors and massage therapists and nurse practitioners and orthodontists. Like, let's bring everybody together to chat about this. And so our first visit actually had like 22 people, which kind of blew me away. People were actually very receptive and very excited about it. And it was a really good networking event. Like, we've heard about all these people, but now it's like, let's come together and let's meet each other face to face. So we had several of those visits. We had people present cases or present things that they were doing in their office. And so during COVID, we've had a couple Zoom visits with speakers meeting, giving us, their presentations about different things. And so we're very excited about next month.
So excited about next month. And that's actually how that was my first contact with you, I think, was through the DFW. Somebody made a comment to me that, oh, I see there's an Airway group in Dallas and you weren't there. And I was like, what is this Airway group? Like, what? So I reached out to Carla directly on Instagram, and I said, hey, I've heard that you're doing this. I would love to be there at the next meeting. Of course, she was so sweet and welcoming. And that was our first like interaction, I think, together.
I completely forgot about that.
Yeah.
So amazing. Oh my gosh.
Yeah. And so our practice is pretty much referral based right now. So I would say most of the people that we're seeing in the office, I mean, we get a lot of like comprehensive care patients from Instagram and Facebook and moms groups, but most of the patients we see for airway related issues or tongue ties, they're coming because of one of those people within our group. And so, Loria and I are very informal. We like to text with our referral sources and just keep in communication with them. And so we've built up, these networks, and we try to connect people. Like, I had a myofunctional therapist reach out to me, and she wanted to meet one of the physical therapists that see some of our patients. And so it's just about connecting everybody and bringing them together, because we all learn from each other. Like, I don't have all the knowledge, and, we have to use each other to only better our patients.
I love that.
Yeah, me too. I have a lot of follow-up questions off of that, but just bringing the community together is really what it comes down to, and being able to reach out to certain offices. Now, as a healthcare professional, a physician, a doctor, how do you have any advice to those who are hygienists in the airway field or myofunctional therapists? Or do you have any recommendation or advice to those reaching out to other professionals or healthcare providers to be able to offer advice to them? Because you know how sometimes we get well, yeah, I'm sure it's not a tongue tie. Let's wait on it. Let's see, you'll outgrow it, that kind of thing. So when a patient does receive that information, a parent, receives that information, but they still in their gut feeling know that something's not right, until they actually find a myofunctional therapist or a provider that can give that information that says, hey, mom, you know what, your gut is right. How can we as hygienists or myofunctional therapists reach out to other physicians to bring us together?
I think it would be good to ask, find out who their provider is. And if you are helping these patients, you can send them a letter just showing progress. Like, I think that really helps, like, here are photos before, after, here's what we've done, here's what we're working on. And, if you're talking to them about tongue tie and tongue restriction, sometimes it's really hard. They didn't really learn about it. I mean, we have a couple of pediatricians who bring their kids to us, and these moms have admitted to, they've said, we didn't learn about this. Like, it's so fascinating, and I get it, and I want to learn more, because then once these other, providers learn about this and they truly care about their patients and they want what's best for their patients, they're going to want to work with people like you and like Renata, and, people who can better these kids, not just by giving them medicine and treating sickness, hey, this child I see is coming in every time, their mouth is hanging open, their tongue is hanging out. Why is that? Maybe I need to refer them to Renata, she can take a good look, or, another provider who knows about this. So once I think other providers like medical, physicians know what you're doing, and they know that it's not that, what you're talking about, they have trust in you, and then they can refer patients, or they have, they feel good knowing that their patients are seeing you. Does that answer your question?
Yes, thank you. Yes.
It's so difficult to get in with a pediatrician. I feel like those always, you don't even have their email. Like, it's hard to have that communication. Sometimes ENTs also. So what I have done before was printed a report with photos, and I gave my patient, and I said, when you go see them, you take this and you hand it to the doctor before you leave. But sometimes, yes, it's very challenging to get in front of them and for them to even respect us, because we're not even doctors of the mouth.
No, I can see that.
We're not doctors of anything here, not even of the mouth.
Really cool. One of our sleep physicians here, that's one of his big referral sources, is he sends to myofunctional therapists. So I feel like the tide is turning.
Yes.
And he actually was, we invited him to our event next month, and he's coming with some team members, and he was like, how can I broadcast this to some of my, fellow colleagues
worldwide?
We're like,
so,
what? Yeah. So
yeah,
I really feel like where we are today versus where we were 3 years ago, like, just a different story. So I do feel like the tides are going to change, and I mean, think about how many parents now talk about mouth breathing. When I was in my other office 5 years ago, I cannot even recall a mom talking about mouth breathing.
No.
I know, right? Mia, do you have a question? Hey.
Hi, I'm a little bit late, so I'll rather join and listen to you.
Okay, just make sure you don't have a question.
Thank you so much.
Of course. Dr. Hernandez says, are you using Maya Brace series? If yes, what is your success with it? Do you combine it with myofunctional therapy and expanders? Thank you.
We do. Yes. We love the Maya Brace. I mean, that's something that, so my good friend, Lauren Ballinger, she introduced all of the, like, she's the one that opened my eyes to this airway world. And because I feel like what you were saying as a pediatric dentist before, there's so many cavities to take care of and there's so much dental decay. But then once you learn about this, which she opened my eyes with my daughter, she's like, oh, your daughter Alice is so cute. Can I share some things with you?
I love her.
And of course, yes. And so I flew her up to Massachusetts to see her. So that's what we started with Alice, is just nasal clearing, breathing through the nose, and the infant trainer with MyoBrace, and saw such huge results. Huge. I mean, her tonsils were huge before, and they, and I had to say, they just weren't as inflamed. Her voice was really hoarse and raspy, and we took her to an ENT, and they wanted to put her under just to check to see what was going on, but they didn't know if they would find anything. Anyways, it all happened. I feel like it was God sent the way things happened with in my life. Just because I learned so much through Alice, my daughter. And then that was my passion. And I knew that my life was changing as a pediatric dentist. So with the MyoBrace, we love it and we see changes with it. But what Carla and I do in our office is we combine it with expansion. So when we expand a patient, we know we're taking care of structure and we're, getting the expansion that we need. Or some patients, they need that desensitization beforehand because they can't have an appliance. Sometimes we have 3.5 and 4-year-olds. We know we need to expand because they have a severe transverse discrepant deficiency. And so we give them a MyoBrace first to use just to get used to wearing, and they get a calendar with stickers, and we make it so fun and rewarding. And then, because and sometimes they have such a gag reflex, there's no way you could get an expander in their mouth. It's amazing to see even 3 months later. So we do 3 months of MyoBrace at first, and then we can start with expansion. And then they're wonderful with it because they're used to putting it in their mouths. They're not gagging as much. And parents report great results with that. Then after we finish with expansion, we usually also do MyoBrace with some activities. And both of our hygienists here in our office are trained. They've taken Sarah Hornsby's course. They've taken the MyoBrace educator course, and Carla and I have done that as well. So we can help. We know if they have speech issues, we refer to an SLP who's trained in oral myofunctional therapy as a modality. But we do think that is so super important, because if the soft tissue just is dysfunctional and we fix the hard tissue, then it's gonna go back. It's not gonna stay how we want it to. So we use all of it together and really believe in that.
And people, it doesn't get better. Unfortunately, it's slowly is going to keep getting worse. I've had patients ask me, okay, well, what is the time commitment with this? And, how many professionals am I going to have to see? And what kind of, financial commitment is this? And I said, listen, this is a journey. It might take a year, might take 2 years, but this is 2 years of your whole life. If we focus on getting these things worked on now, you're going to live the rest of your life so much healthier and so much better. Instead of ignoring it right now, and then it's just going to keep getting worse and worse and worse. I recently also had somebody else tell me that a teenager's being made fun of because of the way that she speaks and her tongue thrust and her open bite. And it's embarrassing. And she's had braces 3 times, but it keeps moving back. Why? When are, people are going to start asking questions? Why is this happening over and over? Something is not being addressed. You guys have a really cool protocol on assessment for frenectomy and frenuloplasty. How was that developed?
Oh gosh, how was that developed? I mean, it's still developing. becoming an affiliate. I mean, we're constantly changing, and that's something that we tell any team member that we hire. We say, are you adaptable?
Are you open to change?
Because we are
Love
changing
that.
all the time. No, but we do, like Carla said, with all our new patients, and if they're coming in for an airway exam, whether it's for growth and development, or if they say they have a tongue tie, we ask, the health and wellness questionnaire, the pediatric sleep questionnaire. And then from there, we go to, if parents agree and we see a reason to, we take a CBCT, and we send that to beam readers. So we, as pediatric dentists, we have to send off, or we have to have a full radiology report. And we just feel comfortable having an oral maxillofacial radiologist do that for us. And it's just nice to have a separate set of eyes look at it. So we send off for the report. And then once we get, and we take our clinical photographs here in our office. And when I say clinical photographs, it's just an orthodontic series, which we're still working on perfecting with 4-year-olds. It's kind of hard sometimes, but we get that. And then we do our exam, and we take certain little measurements, transverse, we do our tongue to spot, palatal, all the things. Like we have and it's funny because parents are like, wow, my child has never, like, why are y'all? I'm like, I just see what's going on. Like, we just want to have a baseline. And then we send, schedule the parents to come back. So we see them for their first visit, and then we see them back a couple weeks later and go over the beam readers report, all of the photos, and any treatment recommendations and referrals and timelines, things like that. So, today, for instance, I had one patient that only eats certain, like, 3 foods. They're seeing an amazing feeding therapist here in Dallas. And, we can't, there's no way and the child does need expansion, does more than likely will need a tongue tie release. I think that could be a part of the feeding issue, but putting an expander in his mouth, he's going to take his 5 foods to like 1, or, you know what I mean? So it's one of those things I said, work on him with your feeding therapist. Once she gives the green light and feels that he's ready, because she knows, because she's part of our collaborative, and she'll let us know, and y'all call, and we'll start with expansion. We need to make tongue space. And with Carla and I are so big. We love Dr. Zaghi's tongue space, tongue tone, tongue tie. We always talk about that.
That should be the sign.
Yes, those are things. And, once we have tongue space, and we can talk about tongue, strengthen tongue more, and then release the tongue if we need to release the tongue tie. So what else do we do for
Postural photos?
We take postural,
That's amazing.
Yes.
Yeah.
Yes. We have like one of those myobrace grids. So yeah, we do it.
Do you guys do any sleep screening?
We do. We did more when, so we use, I'll let you talk about sleep image. I feel like I'm talking so much.
We used to use sleep image. They used to have a system where it was like a little egg device that the kids would sleep in, and it was really easy. You would tape it on, and then they would bring it back, and we'd upload their data. Really easy. I feel like most of the time we got good results, unless the patients were moving all night long. Fast forward, they're using a ring. I don't know if y'all are familiar with that. We've just been on the struggle bus with that. So we have kind of put that aside right now, just for the meantime, because most of the time it's not going to change our
treatment plan.
Because we're looking for structural issues and functional issues, and then going from there. So we've just put that aside for now. But yeah, we did use that for a while in the beginning until they changed over what their device was.
What were some of the problems that you were finding with the children, the little ones who were using? Were you putting it on their index finger, their thumb? And
I feel like they would move, and then, or if you take it off. So then Carla and I took it home, and we're like, okay, what is going on? Why, and if you move it from one finger to another, the signal cuts off. And so, some kids, I think they may have played, I don't know, like in the signal,
Bluetooth is a big piece of it. So if there's any other Bluetooth things going on, or if the device it's connecting to leaves the room, then it's going to cause.
So the parent's cell phone is away. I get it. And this is not the sleep image. This is the Wellu, however you say it. So they don't have the same software. They do check. It's a different software, so they do check for movement, oxygen, and one more thing. But they don't do like the whole sleep report.
Mhm.
That's a sleep image, but that's pretty much what it looks like if you guys want to know.
Yeah.
I am
sleep
like so opposite on my camera today for some reason. I feel like it's a mirror image. Yeah, it's very similar.
cool because you can send it to a sleep doctor and have it looked at, and it's not that expensive. So the access is there. I think we just honestly, we've been in talks with the company. We just haven't had time to like sit down and like work out the kinks on our end.
And we have a couple colleagues too who
Yeah,
they say like with
they-
kids it works great and
Mhm.
it's working well for them, you know, other dentists, but we just haven't had that luck yet. So we're hoping
Do you guys usually send it for one night?
to.
Yeah.
Okay.
And sometimes because we can get the results immediately, I'll say, you know what, it didn't work. Let's do it again. You know, so
Okay.
we have several of them in the office. We have that flexibility.
That's awesome.
Oh no, I see this. Dr. Hernandez wrote, have you tried a glove? We haven't tried a glove.
We haven't tried a glove, but people say to wrap like tape around it and then wrap around the wrist.
Okay.
Is what I've heard. So
Okay. We'll try that. I'll try a
we
glove.
might try on our
I really want
our
it to
guinea
work.
pigs, our
Well,
kids.
because we want to see like our kids. We always use our children as our guinea pigs. So yeah, we the glove I think would be good to try.
Is that what it's called? Is that the official
Yeah.
name, the glove?
No, may I just butt in a little bit? Thank you so much for sharing your knowledge. And I'm a fellow pediatric dentist. I'm so excited
Okay.
to have you here. What I have done with some of my patients is I've bought a dummy ring because, as you both probably know, I see a lot of my special needs kids. So I actually train them with a dummy ring, and then you kind of get them used to it, and then you put on a glove. So it's a process. And I think similarly, just like other special needs kids, you can do that with younger kids the same way. So after a while, the novelty wears out of throwing it away. So, I mean, of course, there'll always be kids who'll throw it. So just
Yeah.
any glove, Angela, any glove.
Yeah,
Okay.
that's a great idea.
I
Yeah.
love that.
Thank you. I,
Uh,
that's a great idea.
we-
I thought you meant that was the name of the device. I'm like, oh,
No.
wait, what?
No,
So-
it's good. We do have another question over here from Eugenia. I'm not sure what's your profession. I don't know if this is appropriate to ask here, but I was wondering, anything is appropriate on an Airway Circle. You guys are welcome to ask anything.
Yes.
If there's ever a reason to not release a tongue tie that has grade 3 functioning. I currently have a 6-year-old client whose pediatrician told the parents that she would be fine. Of course, that's not his kid. She'll be fine. She's a nose breather, but obviously has a high narrow palate. Just wondering what I can tell the parents. It's difficult because we don't know the whole picture.
Right. I think it comes down to function, and what I always tell parents is like Loria and I, like, yes, we know some function, but we look at structure. So we look at structure and then we rely on our myofunctional therapist for function. And if there's a functional issue, that gives me more reason to treat. Or if I see a structural issue, like their tongue tie is causing the narrow palate, like there has to be a reason to treat. And sometimes parents think everything is fine and dandy and normal, but we all know that sometimes normal is not okay. Like snoring, sometimes as parents are told that's normal, but we all know that's not okay.
Dad snores.
Yeah.
Grandpa snores.
It runs in the family.
Dad's on a CPAP. Yeah.
Yeah.
So I really do feel like we have to rely on the specialists, which in my opinion are the myofunctional therapists for function, or the feeding therapist or speech therapist, whatever you have in your area, because that's going to give you a lot more backing to treat or not treat.
Definitely. I always ask the parents, okay, well, because I have people call me just like, I have a tongue tie and I need a release. My first question is, why do you think you need a release? I want to know, why do you, just because you have a tongue tie, you want to release? Like, why? So I let them always tell me first, oh, it's because I heard that maybe constipation could be related to this, or I heard that maybe me sleeping with my mouth open could be related to this, or, so kind of use that, go back to what are your signs and symptoms Does this, is it really causing an issue that needs to be addressed right now or not? But yes, I definitely do not recommend releasing everybody. Can you tell us about Learning Lab and how to get kids involved in oral health? Your Learning Lab.
So I'm not sure if y'all are familiar with Susan Maples. She's a general dentist who has a passion for oral wellness and whole body health wellness. And I met her at one of Dr. Zaghi's courses and of course fell in love with her. And she was like, you have to come see my practice. So I flew up there, saw her practice, and saw their learning lab, which was so cool. The hygienist spends literally an hour with the child and they go through brushing. And it doesn't matter if they're a comprehensive patient or a periodic patient coming in for regular routine cleanings. They're teaching them, about their oral hygiene, and they use different modalities. So if they used an electric toothbrush the last time, they're using a manual toothbrush, and they're using different kinds of floss and different tools. So the kids, using what works best in their hands. And then they get to do a learning lab experiment, which can be anything from learning about x-rays to painting a sealant to learning about nutrition. And so we have implemented that into our practice, and we had to kind of take a step back from COVID because it just the having that open-based style wasn't really working with COVID, but we do carry some aspects through. So like I'll have patients come in and they're terrified. So we take out the intraoral camera, we have them snap pictures of their teeth and we learn about their teeth, or we brush on a stuffed animal and we learn about the animal's teeth, or we have we have extracted teeth that we've put into stone where they can learn how to put a sealant on a tooth. So we've added in some of the experiments just so kids learn and take ownership in their dental care. And then we also teach nasal clearing, which is kind of our number one thing to go to. Is every comprehensive patient, we really want them to learn nasal clearing, especially if they're having those issues of mouth breathing. We make sure we teach them it, they practice it with us, and then we set them up with a reward system to go home with.
I gotta show you guys a video. I have a 2-year-old and he literally walks up to me. He did it this morning. I have my X-Lear spray right next to my bed and he brings it to me and he makes me put it on.
Love
He's
it.
doing. Everybody's like, how does he handle it? He's good.
Well, you also have to rewind, Renata, that you were so good with doing the nasal clearing on him as well with the syringe. And yeah, you captured that on video and it was pretty amazing. And everyone was in awe at how he did that and let it happen.
Yes. I mean, when I first started the first few tries, it was, of course I didn't like it, but as we just kept going, and I always wrap a towel around him. So his arms, he can't move his arms to pull it out, or, I got to make sure that his head is in a place where he's not going to pull it out and it's going to go all over, the place, the syringe with the saline. But then on the video, you can see that he's fine. I just spray and his snot comes out and he's good. He's not crying. And then I give him a toothbrush and he's playing.
It's like a perfect video. It really is.
You have to start early. Yes, you have to start early. My niece at 3 years old would go by herself on the tub and she would spray every night before bed. 3 years old, she was already doing it by herself.
That's awesome. Oh, that's awesome.
I just remembered, I saw a Brazilian parent recently recommend this. And I don't know if I have it here. The end of a stethoscope, the part that you put in your ears, they put that on the tip of the syringe. Because if you have a regular syringe and you put that in the nose, it hurts. It's a hard piece. So now I do that. I put the little soft piece on top of the syringe and it goes perfectly in the nose where it's just soft and then it's perfect. So it's a little tip.
And it doesn't get stuck?
Mm-mm.
Perfect.
Yeah, it's bigger than his nose.
That is awesome. Not to move away from the nose or anything, but I do want to go back to myofunctional therapy. And a pretty popular question is, at what point do you refer your patients to myofunctional therapy?
I think we refer pretty frequently. So I had a good friend in today with her child, undiagnosed tongue and lip tie, but that we didn't catch when he was a baby. Now he's in that age where you can't really treat it just yet, but he mouth breathes and he has reflux and mouth breathes and chapped lips. And so I was like, this is kind of one of those cases where we need to start going to myofunctional therapy. And I think it's all about planting the seeds. So we plant the seeds and sometimes we make the referral 3 or 6 months later, but we refer pretty frequently just because of our patient population. I think our patient population is probably different than most pediatric dentists, and the fact that a lot of parents have already come to us with knowledge and they're seeking us because of they want whole body health and whole body wellness versus just run them in, run them out, clean, throw on some fluoride and send them on their way. So I would say, yeah, we refer pretty frequently.
Pretty frequently, yes.
That is amazing. And we've gotten many, many messages. I keep looking at my phone because I have Facebook on here. And we have many messages from Naomi. So hello, Naomi. Thank you for watching us. Naomi's great.
Youngest, for myofunctional therapy, how old is your youngest that you have referred?
We have there's a team here in town. Kayla Fontenot has Flower Mound Speech Therapy. And she has a girl that comes to her office 1 day a week on Wednesdays, and she is really good with the little ones.
I mean, she has your daughter holding a section.
My daughter started at 3 and can do tongue clicks and tongue to spot, and she knows all her things.
Mm-hmm.
So we start as early as possible.
Okay. That's
because
great.
young kids, they do have that imitation. They love that. And if you,
please, they want to please, like whatever you ask them to do, they're like, yeah, I can do that. What?
Well, and they make it fun. So it takes a really special person, and like she can get it done.
That's amazing. That is amazing. You guys already talked about MyoBrace. Are there any other appliances, MyoMunchie, that you guys recommend or that you guys are looking to go into besides those two? Do you guys do other expansion appliances?
Absolutely.
Yeah. Loria and I are not like a one size fits all kind of practice, because sometimes you get down the path of the kid with a removable upper expander and it doesn't work.
Mm-hmm.
So you sort of kind of change paths and start over. And so we're constantly expanding our tools in our toolbox. And like last week I was at a Crozat course and just trying to always learn more, because sometimes, like I said, what works for one doesn't work for the other. So we have lots of different tools in our toolbox. Sometimes our go-to is an upper removable expander and a lower fixed expander, just because sometimes that's what a lot of our mentors have used. But we're trying to do that on everybody, but it just didn't work with some of our patients, especially if they're traveling 4 hours to see us. So we kind of change around. Sometimes we do fixed. Sometimes we do, like, I put my kids in an Alpha appliance.
Amazing. Oh my gosh, you guys do all of that.
Wow,
you mentioned earlier that you did expansion. I don't know why I asked again, but that is fantastic that you do all of those.
Well, and some kids, they can't handle having something take up their palate. So we're constantly learning and changing, and it's just like you said, a journey.
Yes. With the lower appliance, do you usually do that one first with the upper or after?
We do the upper usually, and then we start the lower like in conjunction, but we wait at least a couple weeks. Sometimes we wait a month, sometimes 2 months. It just depends. And the reason why we like it, and we hate calling it an expander. So take that back. We're calling it, it's an appliance, and it uprights the molars so it can decrowd the anterior teeth, because we can only get so much upper, maxillary expansion without uprighting those lower molars, because we don't want to be in a buccal crossbite or a Brody bite. So we want to do that, especially these kids that we're seeing. I mean, their lower molars are just lingually inclined, like all the way in, because they're trying to fit with the top teeth. So we just know that. And if those were uprighted, the children would be in crossbite. So we know that's such a transverse maxillary deficiency. We know the maxilla dictates how far the bottom can go. So if we want to keep going and make this nice wide arch for the tongue to fit, we have to upright those molars. So I would say that we use those pretty frequently, and we do it with great success too, because they're pretty simple, and we like the fixed. I mean, we've used the removable shorts before. And I mean, we're trying different things, like I said, all the time, seeing what works best and what works for some patients. And, some moms, they don't want any type of glue in the mouth at all because it's poison. And, you get everything, all these requests, and we try to accommodate as much as we can. But sometimes if we know it's not the right thing, we just say, you know what, I just don't believe it. I don't think this will benefit your child. And, and if they believe someone else will do that, then, that's fine, and everyone can have different choices and opinions, and that's okay. Like, we don't get our feelings hurt from that.
Do you ever see a child with so much lack of AP growth at such a young age, let's say a 5 or a 6-year-old, that you would ever look at them and say, eventually this child's going to need MMA surgery? Or is there something that it can be done before to correct that much lack of AP forward growth?
4 to 6 weeks.
Yeah, because we're pediatric dentists, we're really trying to limit our early interceptive care to 8, depending on the kid, 8 or 9 and under. So some 8-year-olds are losing teeth left and right. So really we want true interceptive care. So we have things we can do to try to mitigate that kind of thing. But there's only one kid I can think of. We haven't started treatment on him because there's too many dental fires going on with sugar bugs and stuff. But when we got our beam readers report back, he was probably the most efficient kid I've seen. But we have some tools in our toolbox that we can use.
So there's hope for those patients and those parents.
Better, maybe their surgery won't be as severe. I don't know. I mean, we can make it better.
I think on a growing child, you have a lot in your toolbox you can use to help them get out of that.
I love that. Do you guys mind telling us a little bit about the Endeavor group?
Yeah.
Well, do you want to start? I can start.
I guess it was probably like April of COVID, April 2020. I knew Lauren Ballinger, and I knew Kevin Boyd. So she reached out to me and said, "Hey, we're going to start meeting and form this group. We have a passion to treat young and under 6." So I was like, I have all the time in the world. I'm on board to meet. So Lauren was best friends with Loria. And so we found a time to meet, and there was probably 5 of us at the time. So we just started slowly meeting Monday after Monday after Monday, and we brought in a couple more people. And so we meet every Monday, and we talk about how are we going to push this through this early treatment 6 and under. And so last year we spoke at the AAPMD. We're doing it again this year. We're trying to do different things, because I think the number one question Loria and I get is, okay, well, where can we go to learn more about this? Where can I go to learn about the expanders? Where can I go to learn about, myofunctional therapy? So we're really trying to, give providers more tools in their toolbox to be able to learn more. So it's been fun. It's been just a lot of learning we have some really cool people in the group.
Incredible, yes.
Oh, our singing crew just showed up. But yeah, Kevin Boyd's in it, Lauren Ballinger, Steve Karstensen, Susan Maples.
What an amazing group.
Sharon Moore is.
Oh my God.
I was going to say, she just sent a message.
Um,
Thanks for listening. Thanks. Been listening and double tasking. Great conversation. She's been listening. Hey, Sharon. We love Sharon. We have one last question. Dr. Tuesday just asked, do you always use protective face masks for AP deficiency?
Not always. I think it depends on the kid's level of like what's going on in their airway and then if they're what age they are. So what's their age, what's going on with their airway, and like do they need to be able to, like, are they mid-face deficient essentially? So we really have looked to Kevin Boyd on that. He has some really good research coming out about what he does with face masks. So
That's amazing. Well, ladies, thank you so much for joining us tonight. This hour went by so quickly. I do have some announcements to make before we leave, and then I'll let you guys say bye to everybody. We have this 3-part series lives going on tomorrow, Saturday, and Sunday. So Friday and Saturday is going to be at 8 p.m. and on Sunday is at 3 p.m. And it's going to be Angela, Tamara, and I. We're going to be talking to dental hygienists that would like to start their facial myofunctional therapy business. We're not going to be teaching myo, but we're going to be teaching, talking about what we have done to start and have a successful business, all the challenges, everything that we have gathered with, research and trying to put our paperwork together. I mean, all the stuff that takes a lot of time. We have a course coming out April 1st, and we're going to be handing all of this to everybody that takes the course. So you can start the course, and in 4 months, you're going to have every single aspect of your business ready to launch, including social media. We're going to talk about marketing, about how to talk about your logo. What should it look like? What do you need on your website? How to start a study group, how to do lunch and learns, building your team. My goodness, we have so much content. We are going to share our favorite tools and how do we use them. So our favorite exercises for those tools. We're going to share how we do an evaluation, how we do a therapy session, how we plan those. But we're not telling you this is how it needs to be done. All of us have taken different courses. So you're going to see a little bit from each one of us, and then you can pick and choose from everybody and take what you'd like. But we are doing this free series tomorrow at 8 p.m. It's I've taken my first myofunctional therapy course now. Day 2 on Saturday is, what is it, Angela? Do you remember?
Oh, day 2. Sorry. I know I'm reading the chat. Sherry Worst says, awesome. I will be there.
It's going to be good.
We're going to talk about comprehensive evaluation,
yes.
Therapy session.
So planning your therapy session and treatment plan with confidence. And then the third day is how to build your team. We're going to be giving you guys a lot of information. The link is in our bio on Instagram for you guys to register for these. They're going to be right here on Zoom. We are going to be live on Instagram, but it's not going to be recorded on Instagram. So you have to register to be able to get the recordings afterwards. But we're super excited to be able to share everything that we know with you guys. So we hope to see you there. Next week, we have some amazing speakers coming to talk to us. Again, every Thursday at 8 p.m. Put that down on your calendars. Thanks everybody for always showing up and always supporting us and sharing our posts and our lives. You also are responsible for growing the airway field and growing and doing what we're doing. Hello, Dr. Damon. Oh, it's your husband. With your kids. All right. Well, you guys can say bye to everybody.
All right.
Thank
you
guys.
so much
We
for tuning in.
appreciate-
This was so fun.
Yeah, we
We
appreciate
look
that.
forward. We're glad you're here, and we really look forward to seeing y'all in Arizona.
Oh,
We'll
yes.
be there.
All right.
Super
Awesome.
exciting. Thank you, everybody. Have a wonderful night.
All right.
Lauren, go to Airway Circle Instagram and just click on the link in the bio. Everything is on there for you to register. All right. Bye, everybody. Good night.
Bye.